Your medical blueprint, what your family history really tells your doctor. Let me be very honest with you. When a doctor asks about your family history, it is not small talk, it's not curiosity, and it's definitely not something we ask just to fill time. We ask because your family history acts like a medical blueprint one that quietly shapes how doctors interpret your symptoms, assess risk, and decide how aggressive or cautious to be. Today, I want to explain what doctors are actually listening for, why this question matters far more than people realize, and how it quietly changes medical decisions even when your current tests look normal. Before we start, this video is general medical education only. It's not medical advice, diagnosis, or treatment. The goal is to help you understand how doctors think. Here's a hard truth most people don't know. Symptoms by themselves are often incomplete information. Two people can walk into a clinic with the exact same symptom, the same pain, the same fatigue, the same dizziness, and doctors may treat them very differently. Why? Because risk is not evenly distributed. Family history helps doctors answer questions like, is this symptom likely to be harmless? Or does this person sit in a higher risk category? Family history doesn't tell us what you have. It tells us how worried we should be. And medicine is largely about deciding when to worry and when not to. When doctors ask about family history, we're not looking for every illness anyone ever had. We're listening for patterns, especially heart disease at a young age, stroke, certain cancers, diabetes, autoimmune conditions. Sudden unexplained deaths and timing matters. A heart attack at age 80 is very different from a heart attack at 45. One suggests aging, the other suggests genetic or inherited risk. That's why doctors often ask, how old were they when this happened? Age changes the meaning of the history. A lot of people think family history is only about genetics. That's only half the story. Families also share diet habits, activity levels, stress patterns, smoking or alcohol exposure, sleep behaviors. So family history captures both inherited biology and shared lifestyle. That's why doctors don't just think, you inherited this. We think, you may be exposed to similar risks over time. This helps us understand long-term probability, not just today's complaint. This is where it gets practical. Family history can change. When doctors start screening how often we monitor, which tests we choose, how low our threshold is to investigate further. For example, chest discomfort in someone with a strong family history of early heart disease raises concerns sooner. Mild symptoms in someone with a family history of certain cancers may prompt earlier investigation. Borderline lab results are interpreted differently depending on background risk. This doesn't mean doctors assume the worst. It means we adjust our margin of safety. Many people say, but I feel fine. Why does this matter? Because medicine isn't only about fixing problems, it's also about preventing the wrong problem from being missed. Family history helps doctors spot risks before symptoms appear, decide who needs closer follow-up, avoid unnecessary testing in low-risk people, focus resources where they matter most. This is not about fear, it's about precision. Let's clear up a few things. Family history does not mean you will get the same disease. It does not guarantee a diagnosis. It does not replace current symptoms or tests. What it does is tilt the scale. Think of it like weather forecasting. Family history doesn't cause a storm, it tells us whether to bring an umbrella. You don't need perfect details. Doctors find it most helpful when you know which relatives were affected, rough ages when it happened. Whether it was sudden or long-term, even partial information helps more than none. And no, doctors are not judging families. We're building context. So the next time a doctor asks about family history, understand this. They're not being nosy. They're not filling a form. They're reading your medical blueprint. This video is general medical education only. If this helped clarify how doctors think, save it and subscribe for clear, honest medical explanations without fear-mongering.